Good morning, my name is Nannozi Rehema, and the research that I'm going to present is titled Occupational Risks Associated to Emptying and Transportation of Fecal Sludge in Humanitarian Settings, a case study of Cox's Bazar in Bangladesh, and below are the authors. The case study area that was selected is the Mega FSTP2, which was constructed by Oxfam. It's located in Kutupalong in the host community. It is a biological treatment plant with a capacity of 180 cubics per day, serving 5 camps, Camp 1 East and West, 2 East and West, the Kutupalong Residence Camp, and the neighboring host community, as illustrated in the diagram on my right. And this sludge is delivered through 2 main ways, which are the intermittent fecal sludge transfer network and the vacuum trucks. And all these activities are coordinated by a humanitarian organization called BRAC. Problem statement is that while humanitarian actors are implementing robust sanitation systems to protect the health of the camp dwellers, the health of the sanitation workers has not been prioritized. Why sanitation workers? This is because they are exposed to a number of occupational hazards as they carry out their work. The research gap is that there has been research done on occupational risks for sanitation workers in municipal settings. However, no such study has been conducted in humanitarian settings. Why Cox's Bazar is because it's the largest refugee camp in the world, and carrying out such a study would significantly contribute to addressing the health and safety challenges faced by the sanitation workers in the camps. The research objectives: one is to determine the potential risks for the sanitation workers using 2 emptying and transportation methods, and then compare the occupational risk related to the different emptying and transportation methods. The data collection methods: one was the key informant interviews, which involved interviewing sanitation workers, the supervisors, and the healthcare providers. 2 was the structured observations, which involved following the sanitation workers to the field and observing them as they carried out their duties. Photo voice, which involved giving the sanitation workers cameras and they capture pictures while they carry out their work and later narrate their view of the risks to the researcher. E. coli indicator analysis to establish the risk, the health risk of to the sanitation workers, and the secondary data review, which included looking at reports and training materials. The fecal sludge catchment area. Across the whole sanitation value chain, the research was focused on emptying and transportation only, and it looked at operations and not maintenance of these systems. The semi-quantitative risk assessments were done using the WHO Sanitation Safety Planning Manual, following the following steps, which are to establish the context, identify who is at risk, how the risk occurs, assess available control measures, scoring the risks using the likelihood and severity table on my right, and determining the risk level using the matrix in the table below. So the results of the research show for the E. coli indicator analysis, the results showed that there was no statistical difference in E. coli concentration of the samples. This was because of the similarity in terms of containment, user interface, which was poor flash, the frequency of emptying, which ranged from 3 weeks to 6 weeks for all containments in the camp, and the nature of annual cleansing material, which was wet, using water since it's a Muslim community in the camp. The risk assessment results, as mentioned above, the risk assessment was conducted basing on the results that were got from the photo voice. This is because the photo voice indicated the actual activities on ground as the sanitation workers were conducting their activities without any bias or in their natural state. So from the table above, the first graph shows that IFSTN has more risks associated to it compared to the vacuum trucks, ranging from low to very high. And the graph on my right shows how the different hazards are spread between the IFSTN and vacuum trucks. As we can see that when it comes to the gray one, exposure to accidents, there is a very high under the IFSTN, yet none in, yet it ranges from medium to low when it comes to the vacuum trucks. Key messages for the implementers. One is for us to meet the to do no harm objective, we need to consider the sanitation workers' safety. Second is that high-tech solutions do not guarantee the workers' safety. Therefore, comprehensive risk assessments should be done for proper hazard identification and mitigation. Third, the major risk categories for the sanitation workers are exposure to fecal oral diseases, musculoskeletal disorders, harmful gases, accidents, and high level of noise. Fourth is that the photo voice is a good tool for humanitarian settings where there is limited access and it reduces the researcher bias. 5 is that the World Health Organization Safety Planning Manual is a good tool and it can be implemented in the humanitarian settings to reduce the risks across the sanitation value chain. Lastly is that the SSP is a participatory approach, so implementing it in a more participatory way and including the sanitation workers may lead to behavior change. So these are the references. Thank you very much.